The effects alcoholism has on communication. My name is Allison Sarenka and I'm a recovering alcoholic. What exactly is alcoholism? According to Addiction Recovery and Treatment blog, it is when someone is physically and mentally dependent on alcohol, a serious psychological illness defined as the inability to stop drinking despite potential or actual negative consequences. Alcoholism affects interpersonal communication in several ways and can still have an effect on someone even after they stop drinking and is getting sober. It will continue to affect the user's life in every way possible until they decide to change what is destroying their life. The main effect it has on interpersonal communication is the deterioration in the physical ability to communicate, according to Healthline Alcoholism and Communication Skills. Let us get a better understanding on alcoholism before we dive into how and what all it affects. There are 5 subtypes of alcoholics. Young adults make up 32%, young antisocial is 21%, and the average age is 26. Functional is 19%, and that includes middle-aged and educated workers. Intermediate family is 19%. They started drinking in their teens. And chronic severe subtype is 9%, and that means alcohol has completely taken over their life. Study done by NIAA. There are also a variety of terms used for someone that abuses alcohol, such as alcohol abuse, alcohol dependency, and today most commonly referred to as alcohol use disorder. Alcoholism occurs when someone drinks so much that their body eventually becomes dependent on it, and alcohol becomes the most important thing in their life. People with alcohol problems will continue to drink even when it causes negative consequences, such as physical, mental, and emotional problems. When you become dependent on alcohol, it does not happen overnight. Over time, when someone drinks so much, chemical changes happen in the brain. These changes increase the pleasurable feelings when you drink, according to Timothy J. Legg. So what happens when someone drinks for a long time? A serious toll on their health can happen. Drinking too much weakens your immune system, higher chance of getting cancer, liver inflammations, heart problems, and most importantly affects the brain, stated by the National Institute on Alcohol Abuse and Alcoholism. How does alcoholism affect interpersonal communication? When someone becomes dependent on alcohol, they are no longer their usual self. It takes over their life and becomes the most important thing to them. Alcohol interferes with the brain's communication pathways and affects the way the brain looks and works. This changes the person's mood and behaviors. It leads to slurred speech and short-term effect, and long-term effect, it impacts on the ability to perceive and differentiate information. A new study suggests that alcoholism can lead to a loss of ability to express different emotions through their tone of voice, according to Healthline, meaning their lack of emotion and their tone of voice can lead to confusion and harm in relationships. They are less expressive and flatter, lack the ability to perceive different emotions, both visually and verbally. The reason is still unclear as to how this happens, but some experts suggest damage to the vocal cords or brain. Drinking long-term eventually affects your emotional side, leaving you with anxiety, depression, physical outbursts, relational distance, and isolation. Alcohol is a general depressant of the nervous system. Heavy drinking has been linked to brain atrophy in the right hemisphere. The right side of the brain is key to producing emotions, as well as affecting the voice pitch, said Silke Paulman, a science professor at the University of Essex. Not only the lack of interest, but users also become easily agitated, always drowsy, and have a lot of confusion. They will start to withdraw from family functions and be less supportive of friends and family. A person with alcoholism will become passive-aggressive, which is the avoidance of direct confrontation, push others away, reject others' ideas, hide their feelings, and lack emotions. They are maybe insecure in some areas, so they will overcompensate in others. This all goes back to alcohol being their number one in their life. Alcoholism not only affects their emotional and mental well-being, but what about the people around them that have to deal with the constant alcohol abuse? Financial and social and relationship problems come as well. Financial troubles can happen from the excessive drinking, the amount of money they spend on alcohol, also losing work due to calling in for illness, or possibly even losing jobs. Social aspects are not going to certain functions because alcohol is prohibited, isolating to drink alone, and missing events for your children or them dealing with the abuse or neglect at the hands of the alcoholic parent. So why or how does someone turn into an alcoholic? Some may suffer from anxiety and may not be very social, so need some liquid courage to help calm their nerves. Others suffer from low self-esteem, so they want to feel better and turn to alcohol. When someone starts drinking, I do not think their thought or goal is to become an alcoholic. Well, mine, however, was not. Alcoholism is hereditary in my family, which means 50% of the risk of alcoholism in a family results from genetic factors, according to NIAA. I started out socially drinking with friends, would not drink around my son or on work nights. Then it turned into an every Friday night thing. I would find a babysitter and would let my hair down. Then my son's dad and I started having problems in our relationship. We were both kids with a child, so it turned into a few drinks during the week to release some stress, and of course my Friday nights. My ex and I ended up splitting before my child were 1. I was 19 years old and now a single parent. Once we split, he was gone out of the picture. Once I started drinking my problems away, that is when it all went downhill. I struggled for 8 years. You lose yourself and your identity in the process. I did not drink every day, but when I would drink, I would make up for the lost times I didn't, and there was no stopping. I would drink before family functions, during family functions, after work, weekends, cookouts, you name it, I had an excuse to drink. The things you used to enjoy are now replaced with alcohol. I had every reason to get clean and sober, a beautiful child, good job, nice place, an amazing support system. But I chose to be a functioning alcoholic instead. It is not that I did not love my son or my family. I did not love myself and I wasn't ready. I had been to jail more times than I'd like to admit, lost several friends and even family members due to my behaviors while being intoxicated, and even lost jobs. None of that pushed me to get sober. I was truly labeled as a functioning alcoholic, which is I was able to still function like a normal person, had a job, take care of my child and the daily chores, but I was still an alcoholic. You can hold interventions for the addict, you can cut them off, and even go as far as being an enabler, which is a person or thing that makes something possible. Until the addict is truly ready to change, there is not much you can do. I had enough, tired of feeling sick all the time, tired of being depressed, and tired of putting the blame on everyone and everything else but myself. I was ready to be the woman I was made to be. I started going to counseling, attending AA meetings, and relied on my support system anytime I was struggling. I had to put my pride aside and reach out when I needed help. What people need to understand is I will struggle with this for the rest of my life, but it will get easier over time. I've been sober for years. I still struggle, and I have good days and bad days. Sometimes even want to cave in, but that's the addiction talking. I look back and see how far I've come and have no desire to take those steps backwards. There are several options for getting help. Some options work for others while other options do not. Also, it depends on the severity of the addiction or the kind of treatment that may work best for them. Usually when you go somewhere for treatment, the first process is getting an assessment done, which is the evaluation of the client for substance abuse, mental health conditions, and medical status to determine a plan and structure for the process of their sobriety. There are outpatient programs that offer classes for 4 weeks, and it assists with the extended recovery efforts. There is more extensive treatment such as intensive program, which is a 30-day program on-site stay. They receive 24/7 care and support. There's a continuing care that assists you during your recovery by attending programs such as behavioral treatment, which is a one-on-one with a counselor or therapist. Goal is to help change the behaviors of the alcoholics so they can pick up new habits and get rid of the old. 12-step programs to recognize you have a problem and complete the 12 steps with others or by yourself and have a sponsor that holds you accountable, but that is there for you when needed. They even have medication out there to help curb the cravings that others have. Finding the right solution will be trial and error. It is not going to be easy, and that person must put their pride aside and find the right help for them. It may take some time to find the right fit, but it is out there. I went through 3 counselors until I found the right one. They also have counselors and groups for your loved ones to learn how to cope with the addict in the family or to receive proper tools to help them get through it. Research done by the National Institute on Alcohol Abuse and Alcoholism shows that about 1/3 of people who are treated for alcohol problems have no further symptoms a year later. Many others substantially reduce their drinking and report fewer alcohol-related problems. So what is alcoholism? Some may argue it's a disease. Some may say it's hereditary. One thing everyone can agree on: when alcoholism hits the family in a negative way, it is nothing short but destructive for the whole family and anyone else around. It changes the person struggling with addiction from behaviors to looks and morals and values. Problem is alcohol is everywhere and it is legal. It is at restaurants, celebrations. Really, it seems any to get together, it's present. When someone is in the process of getting sober, their old life can no longer be present, meaning I stopped hanging out with certain friends that I knew were not good for me anymore. I chose not to go to certain places that I felt would make me uncomfortable or jeopardize my sobriety. I had to relearn a lot, how to deal with problems sober, get my anxiety under control, because I no longer had that liquid courage that would ease my anxiety. There are a lot of things I had to change. Over time, it does get easier. The person just must really want it and stick with it. The reward at the end is totally worth it. They will start to find their identity again, find out what makes them happy again, bend or mend relationships that got ruined from alcohol. Most of all recovering alcoholics need a good support system to help them and hold them accountable. It is never too late. If I can do it, anyone can. Thank you.